If we're responding to a crisis, we're late. People need to get to us before there is a crisis. My name is Liban Gabriel Mikael. Taibu is a Kiswahili word, and it means be in good health. The founder of this organization really wanted to give a name that is rooted in an African descent, and so that's why they called it Taibu Community Health Center. It was established in the early 2000s to be able to address the challenges and the disparities that Black communities face, whether it is in health or in social outcomes. Health is not just defined as physical health, it also incorporates all the other social determinants of health. From the very beginning, the way that we really wanted to plan and develop the center, including the design of the center and what it should reflect, we really wanted to have that community feel. So as people come into the organization, they can see themselves represented into the design of the space, the staff that they engage with, the colors that are part of the organization. And so that creates a comfort and a trusting environment for people to even begin to seek services. The second important component was that the services that were developed would be culturally appropriate, linguistically appropriate, so that people can access the services the way they want to access those services. We have consulted the communities to say, what services do you want to see in this space? The program is not just delivered by us, it's delivered with the community for the community. For the primary care groups, we made sure that for those who are very vulnerable and required to be seen, that we continue to see them in person. But we had to stop all our community programs because of the limitation of people to be in one space. So that was a huge challenge. To give you an example, we have a very strong community-based seniors program here. We have what is called the Ubuntu Village Project. Ubuntu is a Zulu concept from South Africa, and it means I am because we are. And if I'm not well, not everybody in the community will be well. So that's what we've been creating in the communities with this Ubuntu Village Project. One of the barriers that we wanted to address with the seniors was social isolation. So we did a lot of outreach to get seniors out to come for activities, whether it was, lion salsa dancing or cooking or things like that. And suddenly we were telling them, no more connection. You need to go back and lock yourself down. So that has been a very significant challenge for us. But we also saw that there was some strength with some of the things that we have been doing. And there is this story I always tell that always touches my heart. So when COVID hit, we also were aware of some seniors who were living by themselves. And so as a group, as a staff team, we said, okay, maybe we need to share their contact numbers among ourselves and do wellness check with a few of them on a weekly basis to see if they're okay. Do they need anything? Have they got contact with their families, either here or abroad? And so we started doing the phone calls. And one day I received a phone call from one of the seniors. So we exchanged a few, how are you? How are you doing? And I said, well, tell me, how can I help you? I know you called, and so there must be something we need to support you with. And she says, no. The seniors group have said that we would take a few of our staff, the staff's number, and we would call you for a wellness check because you're working, you have families, so we want to know how well you're doing. And I was like, I don't believe. She says, no. We have the Ubuntu Elder Council have taken the staff's extension and we're calling all of you to see how you're doing. That was very heartwarming and touching because there was this very strong relationship that the care is mutual. So that was great. It was a very challenging period of time. For the last 2.5 years of COVID, I think I've worked 7 days a week. And from a leadership perspective, there are a lot of meetings, on your feet kind of planning, real time kind of things to do because things had to be changed so quickly. And as a community organization that is working with Black communities, we knew already that the pandemic was going to disproportionately impact Black, Indigenous, and racialized communities. So there was this added challenge. For example, when the pandemic started, we were hearing already from the United States that the Black and Hispanic communities and Native communities were the ones who were impacted. We didn't have anything here in Canada and in Toronto to demonstrate that that was also happening. We knew that was happening. So there was a lot of advocacy that we needed to do. There were other Black health leaders in the city. We got together and advocated for the race-based data collection. And then in June, we had the murder of George Floyd.
Floyd's death has galvanized people to stand up against racism and call for an end to police violence against marginalized communities. Sean O'Shea reports.
The cries for change. For a second day in Toronto, anti-racism protesters carried signs and a clear message.
No justice, no peace.
Many of our staff were impacted by that. And so it was quite challenging. But I also think that it was also rewarding. As much as it was difficult and stressful, rewarding because there was also a lot of work that was done. We had actually 3 messages. Get the facts, get tested, and get support. A lot of people did not have the right facts, so we were providing that information. A lot of people did not know where to get tested, but were also very cautious about being tested, because if they tested positive, they knew that they couldn't go to work. And if they didn't go to work, they knew they were not able to survive. And so we said we will also support you by providing them financial assistance, housing assistance, and stuff like that. So it was very, very busy, but it also was rewarding because we were able to reach those people who needed the support. And then when the vaccine rollout came up, we offered our space to be a vaccine clinic. We partnered with the Black Physician Association so that the vaccinators were also from the community. People would come and they could speak to somebody they could trust. We partnered with the City of Toronto in creating the Black Scientist Task Force for Vaccine Equity. And that was very important to do the education and the community engagement. Not so much to convince or coerce people, but for people to have the right information for them to make the right decision that they feel is right. We start with conversations and relationship building because we know trust is very, very important for Black and racialized and Francophone communities. Traditionally, historically, there has been, and there still exists, a significant mistrust with healthcare, education, criminal justice, because of how Black and racialized communities have been treated, continue to be treated. So when COVID came, a lot of people did not trust what information was being provided, because we know Indigenous Black people have been, mistreated. It's the same thing with police, right? We always try to include police in the work that we do because we have to start that relationship building. But institutions are framed in such a way that they're not easy to change and move. But COVID has created an opportunity where we've seen systems change. So, for example, the death of Regis Korchinski-Paquette.
Questions are still swirling tonight about what exactly happened the moments before a young Black woman fell to her death from her High Park apartment yesterday.
I asked the police yesterday if they could take my daughter to Camp H, and my daughter ended up dead.
So the City of Toronto took a year to consult with communities to try to find an alternative way of responding to community crisis. Taibu was part of that consultation. And then the recommendation was to create a community-led crisis response. The pilot has been established now for a year. We're seeing the results. But the mere fact that when somebody is in crisis, they don't have to deal with somebody in uniform, that's already very de-escalating, and they can engage with somebody that looked like them. It's more of a supportive model. And so that has been established. We have 4 pilots in the city. And many of the police officers said, we are glad that you're here because in many instances, we know we are not the right people to respond. They're not trained, right? When you have a heart attack, it's EMS that responds because it's a health situation. When you have a mental health crisis, why is it the police that responds? So many of the police are very happy that it is the right service that is going out for response. Our motto here at Taibu is, if we're already responding to a crisis, we're late, right? We need to get to people, or people need to get to us before there is a crisis. Being a Black-focused, Black-led, Black-serving organization, the challenges has been significant. One, because as a staff, we had to respond to this emergency. We had to respond to the traumatic experiences that Black people faced after the murder of George Floyd. And then as individuals, being Black has impacted many of the staff. And one of the things that we did was we opened up some space for staff to have just a space to have a conversation. Then there was also the offer of additional support for staff who may have needed either for them, for their families. The other component was when the vaccine rollout came out, we did not enforce compulsory vaccination. We provided the right information for people to do that. And we said we will support you either way. If there are accommodations, we will make those accommodations. But our accommodations were not just for people who had religious or medical conditions. And guess how much our percentage of vaccinated staff was? 97%. So we were able to achieve what we needed to achieve through discussions, conversations, and allowing people to make informed decisions for them and for their families. There are times when this position could be lonely. Number one, there is expectation that you know everything, you have to solve everything, right? Leaders in this position, I'm sure I'm not the only one who's feeling that way, but the best thing to deal with that is to have a good support network around you. At this level, it's also very important to have a very good, positive, trusting relationship with your board. So you can go there with vulnerability and say, I'm struggling here. If you go to your board only to kind of give positive image, it's not good. If you don't have those difficult discussions with your board, and the board does not know really what is happening with you, but also with the work that you're trying to do and understand the complexities and the problems, that's also not, you have to have that kind of relationship with the board. I was blessed to have a very supportive board. I was blessed and privileged to have been here from the very beginning. 2008, we were 5, then we were 8. Today we're close to 100 staff. When we started, we had, I think, $1.2 million budget. We're at $14 million today. So to really see this progress, and most beautifully to work with all the communities out there and to see the results that we can do, that is what drives me on a daily basis. We definitely can bring about change in our communities, and we're seeing on an individual level. But change is also possible at the community level, at the systems level.